welcome back to the Able Exchange. Today's episode is a really special one. It's especially for parents trying to understand their child beyond just behavior. So I'm joined with Dr. Ola Phyktina. She's a DHA licensed psychologist and the medical director and owner of the Wellness Hub in JLT. So Dr. Ola brings a really interesting perspective because she combines clinical psychology with a more holistic approach to well-being. She works with parents, teachers, families, caregivers, and herself. She's not just a lovely therapist, she's a mother herself. So she plays this role, she's done it. So today we're going to talk about something that comes up all the time in our work. It is diagnosis, trauma in children, parenting, and what actually helps children long term. Hi, Ola.
Hi, Joey. Thank you so much for such a warm welcome. It is a pleasure to be here.
Thank you. So, Dr. Ola, I want to start with this. So you're trained as a psychologist.
That's right.
But you also run a wellness hub.
Yes.
So what does that actually look like in practice? Like, what's the reality of that?
Yeah. I think the greatest learning for me as a psychologist and as a mother is that there is more than one way to reach where we want to go. And that one way doesn't exist and doesn't work for everyone. Mm-hmm. So that's why there is more than one. Mm-hmm. So for some people, you can reach to the well-being, to the point where your child is well, you are well, and you're feeling fulfilled, say through the mind.
Yeah.
And I give an example of CBT, cognitive behavioral therapy. Mm-hmm. Amazing, works with so many people. Mm-hmm. Some people do not relate to that. It's not so much the mind-oriented approach. Yeah. So some people feel a lot. Mm-hmm. Every child is different. Maybe you call that a sensitive child, which I don't really like, who is not sensitive, right? Yeah, but let's say the child is more feeling child. Yeah. So perhaps art therapy will work better for them. And then there is another child who's very anxious and you cannot help them neither through the mind nor through the feeling. Mm-hmm. Perhaps they need more bodily based approaches. Mm-hmm. So something like yoga or breath work, or something that, can take their body in and really work with it. Yeah. And my favorite one is about integration. Mm-hmm. So while psychology is great and it integrates many of those things that I already said, cognitive behavioral therapy, art therapy, body work, on the other side, we have holistic wellness. Mm-hmm. And what's holistic wellness? Holistic wellness, same breath work, but maybe mixed a little bit with aromatherapy. Mm-hmm. Perhaps it works for some kids and adults a bit better if their senses are engaged. Yeah. So with the idea, this idea originated of the Wellness Hub from the point is that it's not only psychology, and psychology is usually more mind-oriented. Definitely. And holistic wellness is a little bit more body-oriented and integration of everything that's available.
That's brilliant. So it's literally, there's not a one-size-fits-all.
Definitely, because we are not one size, right? Yeah. So it makes just sense that based on our own uniqueness, on the uniqueness of the child, we tailor an approach which works specifically for an individual. Yeah,
of course. And I think that's quite an important thing to mention, because that's something that we've also talked about on the podcast before, is that with children and with adults and with humans in general, there's no cookie cutter method. Yeah. We're all so different, we're all so individual, and we all have our strengths and weaknesses. And I think our job as clinicians is to sort of see where those strengths are and see where those weaknesses are and how we can help, right?
Absolutely, help and activate the potential. Exactly. Because it can be not a strength, it can be not a weakness, it can be a possibility, a potential. And once you work with certain things, that potential can be activated. Definitely. And it can be helpful for strengths and weaknesses.
Definitely. That's actually a brilliant statement. I love that. So following on from that, where do you think in the current times, where do you feel the biggest gaps are with families?
I think it's that making first step to reach out and to really seek. I don't want to use the word help or support. I want to use the word seek, maybe insight.
Yeah.
Because it's not always about, why I don't like help or support. It puts the child in a position of really like help. Someone who needs help, someone who's not doing well, someone who we need, and it can be associated with certain connotations that, maybe we are all doing something wrong as parents, or maybe we bad parents, or maybe my child is bad. So it's more about seeking insight. What's going on for my child? What's going on for my family? And I can tell you, like, I have more than 15 years of experience working with families, seeing my own kids. I can tell you for sure, one person cannot figure it out, and one person is not supposed to do the job by themselves. It's not possible. Like, I mean, with so much experience, with so much experience, I seek insight from others. I say, okay, I've done this as the mother, I've done that as the mother, but I'm missing something here. What is it? What is the need of my child here? What is the need of my family here? So I think the gap is that bias a little bit, that if I go to see a psychologist, it means I'm not a good parent. Or we are failing as parents.
There's a stigma behind it still.
Absolutely. My kids are not doing well, right? So that bit, it's a gap in understanding. Look, I'm seeking support because I need insight. I need to understand my kid better, and I need to know what it is that I can do better or differently. Differently, I like the word.
I like that word. No.
Differently, perhaps, or maybe the same. Right? Certain things need to be kept the same. And once you've reached out, I think second gap is keeping your mind open and trusting the person who you've reached out to.
Trust the process.
Trust the process.
Of course.
Trust the clinician.
Trust
right?
Clinician.
So give it time. Right? So because you're not going to have a miracle. It's
Nothing
not a magic
overnight.
wand. And it's not supposed to. So we want little steps over the period of time, gradually, so that we can reach the shift.
The shape. Exactly. Nothing amazing or nothing worth it happens overnight. Exactly. No, I agree with you. So following on from that as well, is that something that we see a lot is parents, yes, they're hesitant about reaching out and they're hesitant about starting, and there's a stigma behind it, but they're also quite hesitant with diagnosis. And they're also quite hesitant with assessments. Because a label comes on, and then there's all the connotations associated with the label starts being into the sort of the field. So there's a fear of labeling the child, but at the same time, without clarity, it's difficult to support them properly. So what do you think parents misunderstand about diagnosis?
I think it's a very important topic to discuss, because definitely there's something that is being misunderstood, but there is something else going on, I believe, from my perspective. I'll give you an example. The other day, the tutor of my son said that he's 6, he's not holding the pen right, it's really hard for him. So she said, let's practice with different ways, and then if it doesn't work, let's go to OT. My first reaction, my son needs help with OT, right? And it's unconscious, it's automatic, because what happened to me and what happens to many parents, same story. I'm failing my kid, I'm doing something wrong, my kid is not good. So there's so much fear of failing yourself and your child, and it becomes very scary. Right? So this is one. It becomes really, really tricky. 100%. But the second half, I believe also, that what you mentioned is what parents really misunderstand is that it's not about them. It's not about me and my fear thinking, oh my God, how my son needs the OT. And it's not about my son not, doing great or not doing his best or having some disorder. It's about understanding what's going on for him, so that we can address it as early as possible, early intervention. And when it comes to diagnosis, I feel parents also are scared. You are going to label my child. It's a label, right? But for me as a clinician, I would say, well, for me to work without diagnosis, what am I working with? This is my starting point. It's not labeling. For me, having diagnosis is compulsory so that I have my vision as a therapist of where we're going.
Exactly.
So for me, it's very opposite to, it's not a label, it's my goal, where I want to be.
It's to learn, it's to
It's
understand.
to learn, it's to understand.
Exactly.
Again, it's to support the process, it's develop a skill.
Exactly.
If you don't know what skills are challenging for you, what are you working on? What are you going to develop?
Exactly.
How are you going to support that kid? Right?
You're just kind of guessing.
Yeah.
And then that's when everyone starts guessing with these children, that's when children start to sort of fall within the cracks, right?
And that's what causes lots of anxiety.
Yeah.
And you know that when we do sometimes psychoeducational assessments with you, it's more about anxiety of a parent. How are we going to tell the child that he's ADHD? I had a kid just recently. We did the assessment with you, and then the parents asked me to inform the child about diagnosis without mentioning that it's ADHD. So I tried to focus on more of, there's challenges and your brain works differently. So after crafting that talk and delivering it to the best of my ability, the kid looks at me and says, "So do I have ADHD?" You hear me, right?
Yeah.
And then I go, well, I'm not gonna lie to this smart, child in front of me. I say, yes. Where did you hear about it? What do you know about it? What does it mean? Right? So what does it mean is very different in the child's mind to the parent's mind.
Definitely.
And it's very different in the mind of the teacher or in the mind of the inclusion team who supports the child. Because once the inclusion has the diagnosis, they can actually put the child on the plan to support them.
That's the important part.
Right?
Yeah, it's for the support around it to be adequate and proper.
Yes.
Yeah.
So it's not the misbehaving child anymore.
It's not. No,
right?
It's not. Yeah, it's more about school support, expectation,
absolutely,
therapy, home style arrangements. There's so much around it that sort of changes that requires a diagnosis.
And we are not making them up either, because I hear this from the parents sometimes. So especially those parents who are anxious about, but is this really so? Or maybe the kid will grow out of it.
Yeah.
Well, you cannot just grow out of something overnight. Although as you develop, of course, the changes may be there, but they may not be there. So that's why we say early intervention. Put your anxiety aside, go do assessment, have your diagnosis, have your plan, have your vision, and start working, do the progress review. Within 6 months, I can bet it's not gonna be the same starting point. 100%. But just keep your anxiety, don't do anything, don't provide any intervention, see where you land in a year time and how to come out of it little later.
Even harder.
Yeah, even harder. I'll give you another example with play therapy. I say always, if you bring your child to me when they are 3, 4, 5, 6, I take my puppet and I work through anxiety and fear and trauma and grief. Can I do it with 16-year-olds or 21-year-olds? Not doable
so
anymore.
Much harder.
Yes, very different.
Very different. Different games, different sports. It's completely different point of view. Okay, so Ola, following from that, how would, or rather, what advice would you give parents as to how to choose a good psychologist? Like, how do you know that the psychologist is the right one?
I would say pay attention to 2 things. The first one, of course, the therapist, the psychologist needs to be very well qualified, right? So education matters. And it's not 2 months qualification, 3 months. It depends where they did it, whether they are a member of certain associations. And while this is the basis, I would say the second bit to decide whether it's the right person for you, it's follow your heart. See how you feel in the presence of this person. Do you connect with them? Do you see compassion? Do you see ethical practice? Is this someone that you would let your child stay with on their own and absorb that invisible energy vibe around them? So when I'm not talking about some mysterious energy, I'm talking more about kindness.
Yeah, of course.
Yeah, does the child feel safe in the presence of this? Do you feel safe in the presence of this person? I would tell the parents to watch their language, what words are being used, especially with the little ones, how they react to mistakes when the child make, right? So it's about kindness, compassion, ethical practice, safety.
Safety, because at the end of the day, when we go for services, things like this, you pay for the person. The service is everywhere.
Yes.
You understand? Like, service is everywhere, but you find your person. You understand? So that's where I feel like it will make things a lot easier and smoother, and will make you feel more, how do you say, relaxed at heart, really.
Absolutely.
Yeah.
And there is a scientific evidence for this also, because we know that, especially when it comes to psychology, that it's the therapeutic relationship is number one factor that enables the full therapy and outcomes. So without the therapeutic relationship, without the therapeutic alliance between the therapist, the child, and in this situation, the parents, you cannot really use any technique. Because as you said, you need to be relaxed at heart. You need to open up. It's not only your conscious mind, it's your unconscious mind, it's your emotions, it's your feelings. There's so much going on. And it's that trust that is needed in the person in front of you to really talk about your pain, to really let someone witness your anxiety and say, you know what, I'm not doing quite well, I'm struggling with this. You need to feel that you're not being judged for what you say. You need to feel that it's more of a teamwork, that someone is working alongside you rather than someone who is sitting there saying, okay, I have all the answers, do this, do that. This is very different.
Rather than it being an instructor.
Right.
Yeah, someone doing it with you.
Yes, and because your heart cannot take the instruction.
Of course,
right?
of course. It's not logical right now.
Right. And the child's heart. And you cannot rely much on child's logic, especially the younger the child. They really need to be aligned, to be connected to the person in front of them. This is about attachment. No,
that's brilliant. That's really true. So I also think that one of the biggest areas that is not often talked about is trauma in children. So it's so it's never really in the light, because it doesn't always look the way that people expect.
Right.
So that's the problem. But what do you feel what does trauma actually look like to you on a day-to-day basis?
So with trauma, it would also depend on the age of a child that is presenting traumatic symptoms. Let's say with younger kids, it's a little bit easier to see it, because what you will see, will be challenges with sleep. So there'll be disturbed sleep or insomnia, there'll be a lot of anxiety, maybe the child loses appetite, or maybe they eat too much. Sometimes it's clinging to adults in their life, difficulties with school during pick-up, drop-off, difficulties in school itself. You can see the child is crying. So I think with younger kids, it's more visible. But as the child grows and as they are more developed cognitively, they have more capacity, they have more control over presentation of what do they show to the adults in their life. So because not everyone is ready to say when trauma happened, in what circumstances, depending on the type of trauma. Often when it comes to specific types of trauma, especially what I have in mind, if it's a sexual trauma, for example, then it's associated with guilt also and shame. So it won't be also something talked about. Not every child has the vocabulary to describe what happened, private parts and so on. And it's not a conversation that any adult can handle also. So there are many reasons why the older child would keep it inside of them within trying to not to show it. So what I usually see with older kids, and especially I'll tell you the age, 10, 11, teenagers a lot, you could notice that there's some risky behaviors develop. What do I mean by risky behaviors? Perhaps they will take some pictures even of themselves crying and post it to the friends to see, or to certain friends to see, not necessarily to everyone. Or sometimes we can see self-harm. And when we talk about self-harm, I think the first image that comes to many people's mind is something visible, like cutting or something that you can see, but it's not necessarily the case. Sometimes it can be pulling hair, right? Sometimes it can be biting nails too much till the fingers start bleeding. So there's so much can be going on. And I think with all the kids, it's all about being very attentive to what's changed with my child. I think with all the kids, it's about becoming quieter and not to be as forthcoming, not to be as open. And again, it's a little tricky because with teenage, that's usually what you would expect from a teenager, being a little bit within themselves, right? But that's usually the things that you would be paying attention to when it comes to trauma. In many cases, parents already aware of the trauma, say if it's related to regional conflicts, so maybe some families already experience sudden moves to a different country and settling in the new country. Language barriers, again, can come what I call as secondary trauma in a way, because if you are already socially disconnected from your original place and then you cannot integrate in the new place, again, this experience is traumatic. And sometimes trauma can look very different. Sometimes it's losing your favorite pet. Maybe dog passed away. And it is trauma for the child and an adult. Sometimes it's, again, as I said, moving the country and not having grandma or grandpa next to your side. It is trauma. So sometimes trauma is very clear, clinically significant, and we look for certain severe symptoms. Sometimes trauma is not visible. In most cases, it's very invisible. And you can see a lot of misbehavior in children also. Right? Outbursts, meltdowns, anger.
We see a lot of behaviors labeled as naughty or difficult or things like that. When the child's actually overwhelmed or dysregulated or feeling unsafe in some sort of way, you know? So children don't misbehave for no reason, right?
There's always a need. There is a hidden need. The kid doesn't know how to understand what I need and how to express the need. Very often we as parents we misunderstand the behavior. Instead of looking into what needs my child is trying to tell me.
Behavior is communication.
We say, oh, not doing this, not doing that. And what happens as a parent with so much pressure also, work, there's so many duties, right? I'm not saying that, parents just don't pay attention to it. It's not the case, right? Parents already have so much load on them. But when this extra load of child's misbehavior adds on top of it, parents tend to say, this is wrong. I need to stop it. And when we stop it, we bury all of that without understanding the reason. So everything piles up, and then the kid explodes, erupts, and then the parent erupts, and then more disconnection happens, right? And that's why that insight that we talked about is so important, to bring this back together,
100%.
Like a puzzle with small pieces.
100%. And I think that this is where the conversation gets really important, because people often assume that talking to children is enough. So there's actually, what we see is that there's usually limits of just talk-based therapy, especially for younger children, right?
Absolutely.
So what we see is that trauma isn't all emotional. It's not just emotional, it's stored in the body as well.
Absolutely.
Right. So even if a child understands something cognitively, it's their nervous system which is still underneath like a state of stress, you know. So that's where things such as play therapy and such as occupational therapy, and this is where those sort of therapy really help with regulation and really help with processing and really help with even sensory processing. You understand? So there's not a one size fits all, once again, right?
Right, absolutely. And some parents say, tell me why you did it, tell me. I mean, I can tell you the kids don't know why they did it. They just felt angry and they did it.
They just did it,
Yeah, and that's why these creative interventions, they help the child perhaps sometimes put the words on it, but sometimes just work through the experience without necessarily involving the vocabulary. Because as we know with you from child development, emotionally, children develop before their emotional development goes before their verbal development, right? So they feel, but they don't have the capacity to have enough cognition to understand, and then not enough capacity for the vocabulary to label the experience. So that's why when you put the child with anxiety or with someone who's going through grief, right? Or someone who has low self-esteem, when you put them next to the sand tray and you have that sand, and then they can put their hands in the sand, and then they have figurines, and they have an adult who's not judging, who's allowing the space to engage, to have that freedom to be who you are without any duty, obligation, to be someone, to learn a new skill. Yeah, you can just be yourself and relax in the moment. Something's shifting in the nervous system. The nervous system comes down. It means, okay, I can do something. Then what happens? Symbols come through your unconscious mind. Symbols in the form of figurines, right? It can be a tiger or it can be a soldier, and then you see that scene happening in front of your eyes in that sand tray, and the child is working through whatever it is, anxiety, grief, through developing that scene. And then you see that scene is changing as the child is progressing through their therapy. Maybe it started with fighting and one animal's eating others all the time, and then in 6 sessions you see, there's some space where they can actually have a peaceful, meal or picnic together. So we're moving from the fighting anger to nurture and teamwork, right? But it's very symbolic.
100%, yeah. So that's I don't think that's a thing that not many parents know about, is how effective play therapy and how the sand tray, and because it's not usually talked about in everyday sort of life, right? It's quite of a niche sort of program, but it is super effective.
Super effective. And then some parents also can say, but my child is not suffering any anxiety disorder, or they haven't experienced grief. Why would we go for play therapy? What is the point? And I always answer, the point is that it helps your child process their experiences, it supports their development, and it builds certain skills such as confidence building, right? It connects you to your body. You can learn mindfulness. You can learn certain anti-bullying, we run anti-bullying programs, for example, and it could be, slightly different, not therapy per se, but it could be taught through the symbols, through the storytelling, through the creative part that the child can relate to and develop a skill. Who doesn't have emotions? Okay, it doesn't have to be grief or trauma, but who doesn't feel? Who goes through their day without feeling upset or angry or frustrated? I do.
Everyone does. And that's one of the most important, and I think sometimes the hardest parts of this is the role of the parent. Because there's a huge correlation between the child's progress and the impact of a parent. You understand? So, in your opinion, how much of a child's progress actually depends on the parent changing first?
This is the triangle. Right? This is my favorite triangle. Child is always in the middle.
Okay.
Whatever happens in the child's life, in their heart, in their mind, in their environment is dependent on the other factors. And this is school, right? This is parents, and this is social environment, larger social environment. Sometimes I relate it also to the external services like therapy, right? So without all the three working together and holding the child within, we will move very slow. Very slowly the process will be. And when the child shows certain behavior, it's not on parents. It doesn't mean they are bad parents or that, the child yells. It doesn't mean that parents yell at each other. But what it means that the child presents with a challenge what is the most effective response to come from where they are to where we want them to be. Right? So if we don't want them yelling, what do we want? Do we want them expressing their needs by saying, I need a minute? This was with my son. I think I told you this story before.
You did,
So when he was, I think he was around 2.5, he would, when he melts down, he would scream at me, go away. And I said, oh my goodness, we don't scream in the family. We are very peaceful with my husband. Why is he screaming at us? Go away, go away. Something like that. And then I thought, what's happening for him? I told him, I think you need a minute. I think you want to say, I need a minute. So I would model this for him over and over and over again. Do you think he would stop screaming? No, he wouldn't. I would sit in the garden crying, saying, my book is not working. I'm doing everything by book, it's not working. But I didn't have any more options. What else can I do? I'm not the parent who's gonna punish him or yell back or hit, especially, right? So I kept what I knew. I kept doing what I could do. 6 months. It took 6 months. First time we heard him say, I need a minute. Right? And for us as parents, it was a huge learning.
That's amazing. Yeah.
And then the story doesn't finish here. When he had his younger sibling, and when his little brother started screaming, go away, everyone, he told him, I think you want to say, just say, I need a minute. And for us, again, with my husband, we're, oh my God, it travels. So at 6, he could teach his 6'5", he was 5 at the time. He could teach his little brother to say, I need a minute.
Amazing, isn't it?
Right? Yeah.
That's amazing. That's
consistency.
Amazing. Modeling as well.
Modeling, consistency, and just keeping doing it. Just keep going, keep doing it.
And just persevere, be consistent. So we see this a lot, actually, that even parents are doing the best, but they're exhausted, they're overwhelmed, and sometimes, more often than not, reacting rather than responding. So even simple shifts like the one you just mentioned, just like a simple shift, like changes how a parent sort of interprets the behavior, and also how children interpret their own behavior, right? So it kind of goes from my child is being difficult to my child is having a difficult time.
Yes, absolutely.
And that in turn changes how you respond.
Absolutely. It's not about me telling you. It's about what you're doing is right or wrong. This is what we do or this is what we don't do. It's not because of me. It's either the screen time is at 2 o'clock or it's not. 2 o'clock, it's not screen time. It's not because you've done everything so well and today I'm in the mood, so I'm going to give you the screen time. And it's not because I'm so busy, here's your screen, just keep quiet while I do this. Right? And I'm, as a parent, I relate to these things done out of convenience. It's still there, right? But I think it takes mindfulness, and it's more, where are we going with this?
Definitely.
And how is it gonna backfire, or is it gonna be investing something to have actually the positive outcome or the desirable outcome? It's not that my child is bad, it's that they having the difficult behaviors. Right? There's the needs that they are trying to express. I would say to every parent, before your child goes to bed, tell them, you're a good boy or you're a good girl. It's not connected to any action. They are good by default. And with that sense of goodness within, they would allow themselves to make mistakes and learn and move towards, I'm good. I'm a good boy. I'm a good girl.
So this is why parent counselling is so important.
Right.
100%, because I feel like a lot of this can be ironed out or talked about or processed in a parent counselling session, and even with CBT for parents, because it becomes so sort of, it's powerful. It's so much more powerful than people think it is.
And with the CBT for parents, I think what works really well is seeing the cycle of how the child's thoughts, feelings, behaviors connected to the parents' thoughts, feelings, behaviors, and how it feeds back into the child.
It snowballs. It's generational, isn't it?
And then you see that window. Okay, I as a parent have this window of doing something here differently. So I will see how the full cycle change and shift also.
Yeah.
And it's not fair for the parent to do it all by themselves.
No.
So it's not fair. No one can and no one's supposed to do it. That's why, as you said, it always takes a village. It's always about the village.
Of course. Well, that's pretty profound. So I feel like the biggest takeaway in this conversation is that no single approach works with isolation, because there's not one thing that can happen on its own. It's always a collaboration of things, with a collaboration of people from different points of view that can help things. So children, it's good to understand that children just don't need to be understood, but they need to be supportive as to get the most out of their environment.
Right.
Yeah.
Yes.
So
understood and believed in.
Understood and believed in, the most important thing. Of course.
I think it's that vision of your child that mind in the next 5 years, 10 years, 15 years. You respond to your child based on the vision you hold for them, not in response to what you're seeing in front of your eyes. That's what allows you to step up and to give them an opportunity to step up, because this is what parenting is about.
100%,
right?
100%.
It's about helping young minds, young children to develop skills, to learn.
No, that's brilliant. I think that's a really profound take that we can take from this podcast. Yeah. If this episode gave you a bit more perspective as a parent, as a caregiver, as a therapist, make sure to share it with someone who you think needs to hear it. And as always, we'll be back bridging clinical insight with real life application. If you would like to get in touch with Dr. Ola and talk about a bit more how she can help your family unit, your children, the school, the therapists, the details of her clinic will be in the description below. This was the Able Exchange. Like, subscribe, and take care. Thank you.